that book. Now, online, there is a handout that is the list of all the vessels that you need to know. So make sure you have that handout available. Typically, through the labs, we spend our time going through each of the pictures and marking off the ones that we don't have to know. Instead of doing that, you already have the list. So instead of going through each individual picture, you have that list. And those are the vessels that we're going to point to. Those are the vessels that you're going to be required to know for the quizzes and the practical. So our first model that we have is going to be the blood vessel. This is figure 31. 32.2 is a slide showing you the artery versus vein. We're not going to do any slide work with this chapter, so you can ignore 32.2. So 32.1, we have the artery, the pink one, and the vein, the blue one. And we're going to have 3 layers of these vessels. So the outermost layer is going to be the tunica externa because it's on the outside. And it's going to be made out of dense, irregular connective tissue. And it's going to have its own little capillary beds to feed it. Then we're going to have the tunica media. That is the middle layer. And this is where we're going to find our smooth muscle. So if we need to constrict the artery or the vein or dilate the artery or the vein, it's the smooth muscle of the tunica media that will either constrict or dilate, so contract or relax. Then we're going to have the inner layer. This is the tunica interna, also known as the tunica intima. So some books use the tunica interna because it's the internal one, so keeping up with the external media interna. Or some books use intima because it's in intimate contact with the blood. Now, the tunica interna is going to be made out of our endothelium, so simple squamous epithelium, and it, again, touches the blood. Now, when we compare the arteries and the veins, again, the arteries are usually going to have much thicker muscle in the tunica media than the veins do. And another way to tell the difference are that the veins are going to have valves. Okay, so they're the only ones that have that. That prevents the blood from settling to your feet when you stand up or responding to gravity. It keeps all that blood going towards the core of the body. Now, we don't see capillaries on this slide or on this model because capillaries are basically just an endothelial tube. They just have the tunica interna. They don't have tunica externa or tunica media, so no smooth muscle, no connective tissue for support on the outside.
I think the tunica media. I could be wrong.
Now, going through, we have our blood vessel guide model. And as we go through this model, again, we're going to point to all the ones that you're responsible for that's on the list. Looking at your figures, figure 32.3 shows you a schematic. So it's basically this vessel branches into this and this vessel. So again, I can ask you kind of questions. Instead of just asking you what vessel do I find in the forearm, I might ask what vessel branches off of this one. So we do need to know the branching patterns of both the arteries and the veins, and the schematic picture just shows you the branching patterns, so you don't have to rely on the body parts. Figure 32.4, 0.5, 0.6, and 32.7 are all showing you the arteries. 32.8 is showing you the schematics of the vein. So just like we did the arteries, the branching pattern. So we might ask which vein is formed by the union of this and that vein. Then we've got the individual pictures. So 32.9, 32.10, 32.11, and 32.12. 32.13 is showing you the pulmonary circulation. We already did that on practical 1, so you can ignore that picture. We've been tested on it, so we don't need to look at it again. 32.14 is fetal circulation, which we will cover in the next lab. So you can ignore that at this moment. We'll look at that again on the next lab. And then we have 32.5, which is the hepatic portal circulation, which we can see on our model. And we will get into that as we're going through and pointing all the vessels. So we're the top half of the body, and then we'll do the bottom half. We'll start by pointing out all the arteries, and then we'll point out all the veins, and then we'll move on to the next picture in the PowerPoint. So when we look at the arteries, again, we start with the heart, and we're going to have our ascending aorta, so it's coming up and out of the heart. We have our aortic arch, it's the arch one, and then we have the descending thoracic aorta, which is behind the heart, and we have the descending abdominal aorta in the abdomen. And as we learned with the heart, there are three branches off of the aorta. We have the left subclavian artery, the left common carotid artery, and the brachiocephalic artery. So the left subclavian artery comes up, then it becomes the left axillary artery and the left brachial artery. The left common carotid artery comes up and it's going to branch into the left external carotid artery and the left internal carotid artery. It doesn't show it very well in this model. This model has a lot of problems, but that's as best as it's going to be here. The brachiocephalic artery does branch into the right common carotid and the right subclavian artery. That branch is actually right behind the vein, so you don't see it. But this is our right common carotid artery, and because the model's head is turned, we can't see the internal or the external one. We have the right subclavian artery, then we become the right axillary artery, then we become the right brachial artery, and then we have the right ulnar artery by the pinky and the right radial artery down by the thumb. When we look at the core of the body, again, we have the descending abdominal aorta. We have the celiac trunk. So this should be coming more at you three-dimensionally, but again, the model doesn't have it popping up. They moved it to the side. So we have the celiac artery and the branches of the celiac artery. We have the splenic artery going to the spleen. So this represents the spleen. We have the hepatic artery, the gastric artery going to the stomach. The stomach should be here. And then we have the hepatic artery going to the liver itself. This right here is the superior mesenteric artery. It's coming at you. So when you see the model in lab, it's kind of coming straight up. And this is our inferior mesenteric artery. We have the left renal artery and the right renal artery. We have the left common iliac artery, the right common iliac artery, the left external iliac artery, the right external iliac artery, the left internal iliac artery, the right internal iliac artery, the right femoral artery, and the left femoral artery. Okay. Looking at the venous system, again, coming up off of the heart, we have the superior vena cava, and below the heart, we have the inferior vena cava. Now, normally the venous system pretty much mirrors itself. The right and the left look identical, but again, our model has his head turned, so it obscures how some of the vessels should actually be sitting. And the model itself, instead of drawing the internal and external jugular arteries, internal external jugular veins correctly, the model maker actually mirrored the carotids, which in real life they do not. So unfortunately, this is horrible looking. So in real life, there should be two branches off here rather than this one. So this is a bad model make in this case. So this is going to be the left brachiocephalic vein, and you would have a right brachiocephalic vein that would look like it, but again, the model has its head turned. We're going to have the left external jugular vein, and you'll have the left internal that should pop off a little bit differently. But again, this model is not very accurate. Then we're going to have the left external jugular vein, and the right external jugular vein, and the right subclavian vein. Here is the left subclavian vein. The left subclavian vein is going to branch into, the right subclavian vein is going to branch into the right axillary vein and the right cephalic vein. This little stubby guy here is the right brachial vein, and then this longer one is the right basilic vein. So the right cephalic and the right basilic join in the elbow to form the right median cubital vein or antecubital vein. So some books will say right median cubital, some books will say right antecubital vein. It just depends on, again, your book and how the branching pattern happens to be. Looking at the venous system under the diaphragm, again, we have the inferior vena cava. You're going to have the hepatic portal system. So you can see the superior mesenteric vein right here and the splenic vein, and they join to form the hepatic portal vein. And then the gastric vein comes into that, all going to the liver. And then your hepatic veins are actually leaving the liver, going to the inferior vena cava. You're going to have the left renal vein and the right renal vein, the left left common iliac vein and the right common iliac vein, the left external iliac vein, the right external iliac vein, the left internal iliac vein, the right internal iliac vein, the left femoral vein, the right femoral vein. They kind of made it a little stub, and this is the right great saphenous vein. So basically, the below the belt shot on the model. So starting with the arteries, we again have the descending abdominal aorta. We have the celiac trunk and the branches of the celiac trunk, the splenic artery, the gastric artery, and the hepatic artery, the superior mesenteric artery and the inferior mesenteric artery. We're going to have the left renal artery and the right renal artery. We have our left common iliac artery and our right common iliac artery, left external iliac artery, right external iliac artery, left internal iliac artery, right internal iliac artery, the right femoral vein, the left femoral vein. This is the left deep femoral vein up here. As we pass the knee, we're going to have the left popliteal vein. And then right after the knee, we have the right anterior tibial, the left anterior tibial artery and the left posterior tibial artery. The right ones, because of the way the foot is positioned, we cannot see them adequately. They'd be going back and behind the tibia. Our venous system, we're going to have the inferior vena cava, and we can just barely make out the hepatic portal system. So the superior mesenteric vein, splenic vein join to form the hepatic portal vein. The gastric vein comes into that, into the liver. We have the left renal vein and the right renal vein, the left common iliac vein, the right common iliac vein, the left external iliac vein, the right external iliac vein, the left internal iliac vein, the right internal iliac vein, the left femoral vein, the right femoral vein, the right great saphenous vein. that's it for the arteries and the veins. So try to keep in mind your rights from your lefts, and then of course the modifications, whether it's common or external, internal.